related to the proposal that was brought to the court from Airback Life Team for memberships for the county. And if I may, I have reprints of that also in case you need them for reference. Is that acceptable, Judge? Hey, Judge, the magistrate's letters were very similar. HealthNet Medical Services is a 501c3 not-for-profit organization that is owned by the 3 academic medical centers in West Virginia. As you can see on the letter, that includes Cabell Huntington Hospital, Charleston Area Medical Center, and West Virginia University Healthcare. We have served Lawrence County for 3 decades. In my previous life, so to speak, I was a flight paramedic. Chris and I did probably 100 flights together in this county during the time that I wore the flight suit. Across our entire service area, we see an organization that is owned ultimately by a Manhattan investment house that is in Appalachia to provide health care, provide transport, but those dollars leave Appalachia. Those dollars leave and go to KKR, the New York-based investment house. We also see time and again that commitments are made to communities like yours, that it can be a turnkey operation, so to speak. That you, as governmental representatives of your constituents, can invest X number of dollars and guarantee that everyone within your county is covered for air medical transport. And gentlemen, that's just not true. There is no capability to transport critically ill infants in incubators inside those aircraft. Their aircraft do not carry blood. They don't have the connection to academic medical centers for training. They're not tied to the medical schools for training. I have a hard time believing that at this very moment in New York City, the folks who ultimately own this company are worried about the delivery of health care in Appalachia. I know for a fact that the board that I work for are Appalachians who run healthcare organizations who make certain that we have the best equipment, the best training, and the dollars that we have are recirculated within healthcare in Appalachia. Very carefully evaluate that, because not only will there be multiple patients that may be flown out of this county that are not able to be cared for by that team. For example, a critically ill child is going to be transported to Cabell Huntington Hospital and the Hoops Family Children's Hospital from Three Rivers Medical Center by a specialty transport team made up of pediatric critical care specialists. Those specialists don't go on airback aircraft. Because of our tie-in to academic medical centers, HealthNet Medical Services provides that service. Another key point is the number of people, your neighbors, folks that you know and that you represent, who are covered by Medicare, Medicaid, and related social services structures to fund their health care. Those are fixed reimbursements. If you have a Medicaid patient that's flown, of which I certainly don't know the percentage, but I would venture to say in this county, as in all of Appalachia, there's a significant percentage of people who are covered by Medicaid. Membership doesn't work. If you amortize the actual investment that you're being asked to make per capita for those that actually could benefit from the membership if they were flown by the aircraft and could, your cost per person is going to go up significantly.
Let me ask you. You're saying a Medicaid patient is what? Explain that again so I understand.
If somebody is covered by Medicaid,
Yes, sir.
there is a fixed reimbursement from the state. We can't balance bill a patient in.
If you agree to participate in Medicaid, you agree to accept what they pay and not bill the patient extra.
That is exactly right.
Okay, thank you.
Yes, sir. Surface of your per capita cost and the people who can actually benefit and the limited impact, this is not a good deal for this county. I think that your leading healthcare provider in this county, Three Rivers Medical Center, understands that. For many years, we have been the preferred aeromedical provider for Greg Kaiser and his folks at Three Rivers Medical Center. I've worked with Greg since he came to Three Rivers soon after the Humana days. We have a good, close relationship, a professional relationship, and we have that trust. Jill Cantrell in the ER has full confidence that we are the provider that can bring the best delivery of care to your patients here in Lawrence County. That's why Three Rivers has that agreement with HealthNet or Medical Services. They do not have it with another provider.